Wednesday, January 1st, 2022 meeting of the Health and Human Services Committee to order. We will begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item number 3 is public comment, and I did not have anyone sign up. Is there anybody on WebEx who wishes to make public comment? All right, moving on to item number 4, the approval of the May 4th, 2022 Health and Human Services Committee meeting minutes. Everyone should have had a chance to review those. Are there any additions or corrections, or is there a motion? Motion by
Supervisor Gonring, I make a motion.
Second by Supervisor Gonring. All those in favor say aye. Aye. Opposed?
Aye.
Motion carries. Item number 5, policy issues, discussions, and potential committee determination. We have none this month. Item number 6, operational functions required by statute, ordinance, or resolution. Also none this month. Brings us to item number 7, educational presentations and committee discussion. 7A, potential updates to the 2018-2022 strategic plan.
Thank you, and good afternoon to the Health and Human Services Committee. I'm going to just do a quick review as far as an update for the 2018-2022 strategic plan. The strategic plan everybody has this copy of the strategic plan, and then this is the executive summary of the comp plan. The main reason for this update is to briefly bring up to speed some of the new supervisors with the strategic plan and the comp plan. The comprehensive plan, which is 190 pages if you have the big book, otherwise the shorter version, which has most of the information in there. Was the strategic plan, or the comp plan, was adopted by the county board in 2016. The comp plan is a 20-year plan that will help guide county leaders in making decisions on a wide array of issues that will help Marathon County be the healthiest, safest, and most prosperous county in the state. The comp plan consists of 64 objectives, and I counted real quick, but about 208 strategies, and it's approximately 190 pages with the full comp plan. The strategic plan is 23 pages and consists of 12 of the 64 objectives from the comp plan. The strategic plan is a 5-year plan, and the strategic plan is due to expire the end of this year. Now, many things have changed since the strategic plan was adopted in 2018, like the pandemic, technology, and of course the new supervisors. I've had discussions with Chairman Gibbs and Administrator Leonard about the strategic plan expiring at the end of this year, and we feel that the strategic plan should not be scrapped but updated. So that leads me to the 3 questions that are on your agenda that I'm asking all standing committees to consider, which will help update the strategic plan. The first question under 7A1 is what new strategies need to be added to the existing objectives in this plan that would be the strategic plan. Second question is, should any of the strategies or objectives be prioritized? And what we are referring to is like 3.3, which is the lead, you're the lead committee for 3.3. And there are 5 objectives, A through E, However, they're not prioritized as far as importance. So that is something that we're asking the committees to consider. And the third question is, are there any objectives or strategies from the 2016 comp plan to be added to the strategic plan? Now, I made this presentation to ERC yesterday, and one of the supervisors brought up a very good question about 64 objectives. And he felt that, 64 objectives, that might be way too much for us to accomplish. And he was right. That's why we have the 5-year comp plan, which at that time, these 12 objectives were brought forward to deal with in the next 5 years, which is, like I said, up in 2022. So what I don't want you to forget, however, that besides the 12 objectives that are in the strategic plan, there are the other objectives that are in the comprehensive plan that could be considered also if one deems that forward sooner. Now, the Health and Human Services Committee is designated as a lead committee for 3 of the 12 objectives in the strategic plan, 3.3, 3.7, and 7.2. Now, like I said, that doesn't mean that committee members should not review all 64 of the strategies or objectives and the strategies that are under them, because, like I said, things have changed since 2018 when we adopted this, and some other issues I know have came up prior or after we had adopted the strategic plan, which had the 12 objectives in it. Anytime if you have any questions, just stop me if you're not sure of what I'm referring to, or I'm trying to go through this as quickly as I can. Now, I know if we go back to the 3 questions, starting with question number 1, what new strategies need to be added to existing objectives in this plan? And there are, like I said, 208 strategies that are under these 64 objectives. So there may be some strategies now that committee members might feel that we should be dealing with, sooner than putting it on the back burner, which is in the comp plan. It's still there, but if there's issues that have changed in the last 5 years that possibly should be dealt with sooner than later, those are ideas that we're looking for to update this strategic plan. Now, I know there's been a lot of accomplishments made from the Health and Human Services Committee on some of the objectives, some of the strategies. So they may need to be updated also. Are there any questions on that? The first question, as far as what strategies should be added, and like I said, they're in here, and I believe they are listed in the executive plan, not as detailed as here.
Is there a deadline for this? Are you looking for feedback today, or is this something as a committee we should be working on over the next period of time?
Thank you for that question. Yes, what I'm looking at is to start the feedback now, but I certainly don't realize that you're not going to have questions now as far as the other strategies that were listed under there. So what I would like to do is follow up next month with this committee and the other committees to see, after they reviewed those 3 questions, if there are any strategies that you think, should be, existing in the objectives in the strategic plan. Any question? You had a question?
Well, I was going to add an area to one of the objectives.
To where?
I was going to talk about what I thought would be important under Objective 3.7, Strategy D, on page 10.
Okay.
For those who have the booklet. And that was the result of the pandemic has created double the homelessness in Marathon County, double the suicides, double the crimes. And I had just housed 2 homeless people for 10 days that had been living under the bridge. And of course, my district is different than many of the Marathon County board members because mine is not rural. It's right in the city. And I did know these people a little bit, so they were not complete strangers. But they did have health issues that weren't being addressed. And after they left me, they went to living in a tent in someone's backyard. And I happened to look at some of the Marathon County's North Central Healthcare's budget, and I did see that it's in sad shape because of the high costs of construction and the downline and all these products and things that were either absent or had to be remade that cost much more money. So, but the Marathon County North Central Healthcare has a crisis unit, and it would be so good if some of these homeless people would be able to have a place to stay under the North Central Healthcare, and then they can be, while they're staying there, because their immediate need is shelter, a roof over their head, and food. And then while they're there, they could be tested for illegal drugs, mental health issues, family relationships, crises there, just whatever they need help with. Because it's not serving our community to have a lot of people without housing, being homeless, and creating problems for the police department, the city, and the county sheriff's department. I did talk to Beleb and Scott Parks about it, and the city may be doing a little something, but I think, we have North Central Healthcare, and I think we should take part in some of the homeless problems too.
Thank you. I'm glad you brought that up because that is one of our objectives in the comp plan under Chapter 4, Community Character. 4.1, it says promote a variety of safe and affordable housing options that meet the needs of all community members. And then it lists strategy A through H on how that could be done. And like I said, Administrator Leonard and I did talk about this one at 4.1. And we thought with the problems that have existed are a lot more than they were probably 5 years ago, or they're more noticeable now than they were then. So that is a priority that I agree with you should be added or be part of this strategic plan. And that's just my opinion. I don't know, Supervisor Leonard, if you had, or Administrator Leonard, do you have any follow-up on that?
Sure, thank you, Mr. Chair, or Vice Chair, I should say. Vice Chair McEwen, and in fact, I did put up on the screen the objective that you just referenced from the comprehensive plan, which is 4.1. So again, I think that the questions that Vice Chair McEwen referenced for you, really, I think, I'm a big framing person. I like to frame what the conversation is because my interactions with you, I really try to keep you focused on your role that you heard during your training from the Wisconsin County Association. Be visionary. We will figure out. Staff will develop the how, whether it's North Central or some other mechanism to address the issue. The thing we need from you are the pieces that the Vice Chair referenced. Thinking from that high level. What in the strategic plan in terms of strategies, what's missing? That's the first question. Simply put, the second question is, are there strategies that are in the plan that you think, hey, these are the most important strategies we need to move on? Then the last question is, are there objectives or strategies that are in the comp plan that, for the reasons the Vice Chair referenced, hey, things are different than they were 5 years ago or 2 years ago? We need to make those a priority and get them into the strategic plan if we extend the strategic plan for a period of time. And I think the comment you made about we're hearing a lot about affordable housing. And when you read through the comprehensive plan, and I think that's your homework to Chair Van Cray's point, as you continue this work, read through the comprehensive plan. You'll see, quite honestly, it's a wonderful piece of work that a lot of the stuff you just referenced, credit to the county board in 2016, you had that as objective 4.1, promote a variety of safe and affordable housing options that meet the needs of all community members. And a lot of the strategies through A through H tick off a lot of the things you just said. The question you have is that now a priority that it needs to be in the strategic plan or not? And you ultimately as the policymakers, you are in charge, simply put, of where we put our time, energy, and effort. You do that through the annual work plan and the annual budget primarily. So this is a resource allocation issue. Does affordable housing now jump up into that strategic plan because, hey, we need to be eyes on that and really take that from the 64 priority list over 20 years to no, we need to start looking at that right away. At ERC yesterday, the Vice Chair McEwen gave 2 examples to illustrate kind of the process he was hoping that each committee go through. The first was what you just referenced, affordable housing, and the second, another thing we heard a lot about over the last several months, and if you've watched the news, you've seen a recurring segment on it, childcare. That too, actually, when you read through your comprehensive plan, it's in there. And the vice chair can probably tell me what number it is, but I know it's 10.1.1A.
Yeah, 10.1A, it's on page 163.
Yep. So you'll see now I scroll to that. Develop policies that support affordable, high-quality childcare. Your colleagues at the Extension Education Economic Development Committee have said, at the end of last term, they said, this is a priority. We want administration to start working on that. It was built into the annual work plan, and we've been doing work, building some stakeholder groups. And in fact, if you are looking for an event tomorrow to watch on the news, we are happy to report, and it's been released today, so I can say it. Marathon County is one of the first round of grant recipients through the Department of Children and Families for their Partner Up or Dream Up childcare grant. We have a stakeholder group of 19 stakeholders. Marathon County government was the lead grant applicant, partnering with North Central Technical College, the school districts, the city, and a lot of others. But we got a $75,000 grant for technical assistance and strategic planning. So that'll be announced tomorrow. But those are 2 things that the vice chair brought up as examples of potential things that would jump to the top of that list. My only ask of you, and it's in keeping with the comments made at ERC yesterday, I'll paraphrase, it's something we've said in our leadership development group. In order to be effective, you must be selective. We cannot have 20 things added to the strategic plan. You already picked 12. 12 is a lot, because for each of those 12, you have about an average of 5 strategies and 2 to 3 outcome measures for each. So that's already a lot of work. So as you look through, again, those 3 questions that the vice chair is really trying to get at are in keeping with that visionary role. No need for you to get bogged down in the weeds about, all right, how do we address affordable housing other than the strategies that you've already listed if you choose to move that objective to the strategic plan. Please understand that staff will bring you back a bill that explains what we expect, what we're asking you to pay for to carry out the things that to achieve the goal. But the question we have for you, and it's coming from Chair Gibbs and Vice Chair McEwen, is what are those new things that jump to the top of the list that we need to make sure are in the plan?
Thank you.
You gotta hold it down.
Gotta hold it till a green light comes on. Oh, it's on.
Thank you, Vice Chair McEwen. So as we go through this information in the strategic plan and the comp plan, and we're trying to, weed out what we need to focus on and where we should set priorities, where do we find the data where we're currently at with these items?
Thank you, that's a very good question. Administrator Leonard did a update on the 2018-2022 strategic plan in 2020, I believe it was. And I'm not sure if everybody received that. He did email it out, and it's very easy to follow because it actually identifies each objective, the strategies, and what's been, done or what has been accomplished on each one of those. And it's very easy to look at. I don't know if Administrator Leonard can email that to everybody
Sure,
to look at.
Oh, sorry.
Oh, go ahead. No,
I can show you where that is on the website. To your point, though, it was done in 2020. I think staff are gonna have to start to look at, if you want specific data measures, we're gonna have to put in some work to get them. And we can do that. It's always a resource allocation issue. But to at least find the last data we have, if you go to the Marathon County homepage.
We also have a document as a committee, I think it's probably going on maybe 3 or 4 years that it's been utilized, and it has the different objectives and strategies, and then things that we've accomplished as a committee over that time have kind of been put into that chart. So I can make sure that the entire committee has that as well.
okay.
So if you go to the Excellence tab at the top and then click on Strategic Plan, the 2020 Strategic Plan Update is a link there. And as the Vice Chair referenced, it's set up in largely the same way, and you'll see progress. Again, this is staff progress. To Chair Van Cray's point, the committee discussions have been captured. Each committee chair has tried to keep a living document with the items that they've been working on, but here are a number of the initiatives we've undertaken as a result of the strategic plan that the board adopted. The other good place always to look is the annual budget, particularly in the individual department sections. There are 2 pages for every department, and they talk about initiatives that they're doing. But for your objectives, I would start with the 2020 update.
Okay, thank you. And I think to Supervisor Krause's point was that in the last couple of years, a lot has changed. So, the last update in 2020 might not be as relevant today as it was 2 years ago. So I think, I don't know if, as we go through this and we come up with, can we get progress on suicide rates? Can we get progress on the health status of children, and what they're going through the last couple of years? Where do we need resources for, maybe some counseling or something like that? And how is the healthcare system in Marathon County, how are they dealing with those problems, today versus 2 years ago? I think that's important as well. So I think, I'm glad you brought that up because a lot has changed in the last 2 years.
If I may, and I can see Chair Van Cray's has a template that I've been encouraging all the standing committees to update periodically as far as priorities, objectives that they have accomplished. And ERC is, and I know the past Chair Butke started to do that. I don't know, Chair Van Cray, how far he got on that. But if you want to see a copy of one that's updated probably very frequently, the ERC committees has a template which the chair just had there, that it's updated with the progress that's been made. It's been presented to the county board. It's been passed by the county board. It's pending. So, if and that would be up to your chair, if she wants to fill that out, it would be very helpful to try to answer your questions as far as what's been done and the updates on them. But I don't know what your feelings are on it, but.
I think the one we have here was probably updated in the last year. And like I said, I think was Boots the chair before Butke? I think he started it, and then we kind of continued to add to it throughout the term last term. But it has been a while since it's been looked at.
Okay. Yeah. Very good points, thank you.
Yes, I'd like to add something to what Administrator Leonard has said about low-income housing, and I know that that's very sorely needed because the people on poverty level in Wausau, which is the majority of the people that live in Wausau, just can't afford $1,000, $2,000 for an apartment. And I know that these homeless people have no money. It's not that they can't find low-income housing. There are some low-income housing units. I'm in one of them. And but they have zero money, and Salvation Army, Catholic Charities is closed. Salvation Army doesn't take a lot of people, and that's the only shelter that there is for them in this area. And they, in the rural areas, they may come into Wausau looking for shelter. But, and some of the churches do help them, but not a lot. And those that do, they have waiting lists, unbelievable waiting lists. So it's months and months before they might get any assistance, or like say from St. Vincent de Paul, there's a limit on how much money they would help them with the rent. They don't help with security deposit, but they would help a little bit with the rent. But you'd have to have the rest of that rent money. And if they're homeless and out of a job or even having a part-time job, it's hard to come up with $500, $600, $700, $800 for housing. So they need a crisis center. They need a crisis shelter area to tide them over until they find a job and do other things. Thank you.
Supervisor Leahy.
Thank you. This is kind of maybe getting into the nitty-gritty about this one particular issue, but I think it might apply to a lot of these different objectives when we're looking at making updates or prioritizing, is just how we're communicating with other municipalities and organizations that also help with these issues. I hear a lot about unhoused populations in my day job, and there are a lot of misconceptions about all the different organizations that are out there as resources, including hours of operation of these things, what the requirements are. It might be helpful to invite other people to these discussions when we're talking about what needs to be done and what our strategy should be, because I think a lot of the times we just don't know what other entities are currently doing as well as us. So yeah, I don't know what that means exactly as far as this committee, but maybe it's just inviting other people to these discussions and pooling our resources in more efficient ways. Because the information's out there, but outreach is definitely a key part of reaching a lot of these populations who need help.
Okay, so I think we've identified 4.1 is an objective we are interested in. So I'll encourage the committee to take a look at that in the comp plan and the different strategies. So when we come back for our next meeting, we can maybe narrow it down to a more specific area that we're looking at and see if it's appropriate to add it to our next strategic plan update.
Thank you. And like I said, these are great comments. This is what I was looking for. And like I said, I don't know as far as Chapter 10 with 10.1. I think that falls in the category of 3.3, which you're the lead committee on, ensuring that every child makes it to adulthood with health, stability, and growth opportunities. If they don't have decent child care, I think that affects, can have a negative effect on them. Plus, I'm also looking at economic development as far as parents being able to work if they can get affordable child care, quality child care. And Administrator Leonard said, and I saw a piece on Channel 7, I believe, about a particular county a county employee having difficulty getting quality child care, and it was difficult for her and her husband to be able to juggle the work and, the quality child care. So I have a grandchild, so I don't personally deal with child care, but I know it's an issue. And I strongly would encourage that to be somewhere in there, or maybe a strategy needs to be changed in 3.3. I don't know, but like I said, that's what I would like this committee to look at. You may not have to add another objective. You may be able to fit it in, one of the objectives that Health and Human Services had. And like I said, if you think it would fit into a different committees like Triple ED committee, but like I said, this is the type of conversation I wanted with the committees, and I really appreciate it. Like I said, but it's up to this committee as far as the three objectives, that they are the lead committee, but certainly don't forget about the other 9, that are on there that you're not the lead committee for. It's still part of the strategic plan. So, and one other comment I just wanted to make is the administrator's work plan is based on the strategic plan and the comp plan. And so I would encourage you, if you don't have a copy of the administrator's work plan, to look at that. That's quite was there 35, 36 work plan ideas on there, and he realizes, and we do, that you're not going to accomplish them all, but that doesn't mean we shouldn't keep reviewing it. And then also, I do have the latest copy, which is old, of the life report, the 2019-2021 life report, and they have a specific article in here about childcare. So, and this was back in 2019 when it was developed. So I don't know if you can get any more of these copies of the life report. It's old. Do they come out every 2 years?
I think they do. They might be a little off their schedule because of the pandemic.
Yeah.
But it is available online.
Okay, all right, thank you. And there's a lot of good information, in there, and I have the 17-19 and the 19-21, the recent ones, so. But, like I said, and the comments that were made about trying to involve other community members that were made, excellent. The more information that we can get and the help we can get from community organizations is great, so I think those are good ideas.
So as we're looking at this, what I'm hearing is that it's okay if we take a strategy from a different objective and put it towards, because I do think 10.1A, the develop policies that support affordable, high-quality childcare. Obviously, if Triple ED is going to take that objective on, then they can have it, we can be a support. But that strategy would fit, like you said, into 3.3, but in the comp plan, it's not under 3.3, so would it be okay to add that? Or does that get murky organizationally?
This is your strategic plan.
Okay.
Do with it what you will. Again, I know that it's a lot to get through. Again, my refrain is one of be visionary and keep your minds focused on what are the big issues of the day. We will figure out. I mean, if your strategy is just what you read, support or examine opportunities to support the expansion of affordable, high-quality childcare, staff will bring you back ways to do that. We will reach out to, as Supervisor Leahy referenced, other individuals that are working in a space. If the best way to achieve the goal of the board is to work with North Central, county staff will do that. If the best way to achieve an objective is to work with some other provider, we will reach out and do that. A good example, when you look through the strategic plan update, the county board identified the expansion of mental health services in schools as a priority. County staff brought back a plan and moved forward a plan. We didn't directly do that. We supported the creation and expansion of the school-based mental health consortium. We developed the how. We ask you to pay for it again, but you come up with really high-level why, what's the issue, what do we want to do to address it? We'll figure out how. We'll come back to you again in the budget to pay for it, but don't feel it's really easy to start trying to solve the problem. We need you to tell us what is the problem you want us to solve.
Does anybody else have anything to add to today's discussion? Okay, then I will encourage everybody to take a look at those documents and the ones referenced by the administrator too, and then at our next meeting, we can come back with some more ideas for you.
That would be great, yeah, and the three questions, like I said, that I would like to get into a further discussion with them, with the committee, but after you had a month to look at the different strategies and objectives that are in the comp plan. And, when Administrator Leonard talked about a visionary, I was on the committee that helped develop the comp plan and the strategic plan, and there was a supervisor on there at that time that wanted to hire a visionary. And I thought, I didn't know that what a visionary could do, but we didn't envision a lot of the issues that are now, real problems for people in Marathon County and probably elsewhere, and it might not have been a bad idea. I don't know what information that this visionary could have came up with, but, like I said, now thinking back, I thought he might not have been wrong, but, but, yeah, thank you. Like I said, this is, exactly what I was looking for as far as conversation with updating this strategic plan, because I really don't think we need to throw this out and start over. I think that we can build on this and, and improve it, so. But, yeah, thank you very much for the opportunity to ask the committee to look at that, so thank you.
Thank you. Did you have something to add? Okay. Great, we will move on to item 7B, presentation on foster parents in Marathon County. I think Lance has a presentation.
No, I don't have a presentation. Vicki and Krista from Social Services have a presentation. We're a day late, but as you all know, May is Foster Care Awareness Month across the nation. We are very fortunate in Marathon County to have wonderful foster parents, and I think they're going to start out talking about a couple just to draw special attention to, but they'll give you an overview again of foster parenting in Marathon County. So come on up. Let's make sure this works. Want to play that first, or do you want to
Last, yeah. Okay, yeah, actually, we want to end with our video. I'm going to move this down a little bit. Okay, so again, I'm Vicki Tilka, Director of Social Services, and with me is Krista Jensen, our Child Welfare Manager, who directly supervises the foster care program. So we wanted to talk with you about that, as Lance had said, just finishing up on May, which is really Foster Parent Awareness and Appreciation Month. And just to help to frame what foster parenting is, for people may know this, but foster parents are basically licensed. Krista's going to talk to you a little bit more about what that entails in terms of licensing one or two adults to be a foster family and opening their home up to children to be able to take care of them for a period of time. And that would be in terms of looking at our continuum of care when we place children in out of home. Foster care would be like our least restrictive. Well, first of all, going with a relative, obviously would it be considered that's not even licensed. When we start to get into licensed levels of care, then a foster home is like a family environment, and that certainly is most desirable to be able to place children in those types of settings. And from there, we go up to be more restrictive, more services, more institution-like with group homes and residential care. So whenever possible, we want children to be with their relatives or be with foster families. And that would be in the cases where we do need to remove children from their home. In all cases, we prefer for children to stay at home with their families and work out whatever issues that they have that may come to our attention. But when children need to be placed, we do have the option of looking at foster parents. And again, we're very proud of our foster parent system. The whole goal of foster care is to be able to reunify the children with the biological parents. So from day one, there's a plan. Foster parents are going to take care of these children and provide them a great environment at this point for how long you're needed, but the goal is to return the children to their biological parents. So what we always talk about when we do orientation for foster parents is that we want them to come into it with that philosophy and not to think about adopting. Sometimes people come to us and say they want to adopt, so I want to be a foster parent in order to adopt. We will tell them we are not the proper resource for that. There are other organizations where that can occur. And that's not to say that some of our foster parents don't end up adopting some children when that becomes the permanent plan for that child, but that is never the outright goal. So we always make sure that our foster parents know that they're a really important piece of the child welfare team to be working alongside with the birth parents to be able to get those children back home. So with that, I'm going to turn it over to Krista, who's going to give us lots more specifics about everything.
Good afternoon. So yeah, like Vicki said, we have wonderful foster parents here in Marathon County. We currently have 55 licensed foster homes in Marathon County who provide, some provide short-term, some provide long-term foster care for children, and some only provide respite. Respite is providing essentially like a break for our foster parents who maybe they need to go away for the weekend, or they have things that they need to do, just a date night even. So that's what respite really looks like. It's really short-term. The intention of all of our children who enter foster care is to be very short-term, as Vicki referenced, in order to get them home and create a safety plan within their home, utilizing their natural support systems. But for folks who want to become licensed foster parents, Marathon County does a number of recruitment events. Right now we're doing some recruitment events at churches, and we partner with Welcomed, which is a program that helps to support foster parents when they get placements. They do things like meal trains and respite and things of that nature. So we have 55 of those currently. In order to become a licensed foster parent, there are some requirements. Some of the basic ones are you have to be 21 years old. Your home has to meet certain requirements around what a bedroom really looks like, spacing for children. There's requirements on the number of children that can be in a foster home. 8 is the maximum number of children that can be placed in a foster home without an exception from DCF. And so when families take children in foster care, they do receive payment for that. There is a basic rate that is set by the state for children depending on their ages, and then there are tools that we utilize depending on the child's behavior and the child's needs that could potentially increase that basic rate. Along with that basic rate comes a clothing allowance for every child entering foster care. Sometimes our children are entering foster care with lots of wonderful things, and other times they're entering foster care with very little. And so that allows those foster parents an opportunity to purchase age-appropriate, size-appropriate, weather-appropriate clothing to make sure that our children aren't going without the things that they really need to live day to day. There's a foster care coordinator in Marathon County who completes all of the licenses with these families. We also have a contract with Catholic Charities to help just with the volume of the families that we receive referrals on. So they will help us do some of those foster care licenses, but our foster care coordinator always completes that final home visit, is always that point of contact to support the foster parents here in Marathon County. So she does that initial license, and then she does a home visit every year to check in on them. They relicense every 2 years. Other support that we offer our foster parents is a support group that we recently began just last year. So that's running virtually and in person. And then we also have a foster care Facebook page that provides information on training and opportunities that are happening within the community. And then there's also the social worker that is assigned to each child who enters foster care. So outside of the foster care coordinator, they also have a child protective services or a youth justice social worker who's serving that child, and they're also a point of contact for our foster families to help them walk through the process, understand what the next steps are, and things of that nature. So many of our foster families also not only have relationships with their foster children, but they also end up developing relationships with that foster child's birth family or whoever their caretakers, might have been before that. Those are the situations we love to see because we see that those children end up reunifying a lot faster and they develop a natural support system so that when they go back to mom or dad or grandma or grandpa, they have somebody else to reach out to for some natural support. We have one foster family in Marathon County who has really stood out that we'll share you a little video on in a little bit, but we have multiple foster families in Marathon County who have won the Governor's Award for being the foster care parents of the year. So that's always really exciting. We always have foster parents that we are nominating because of the things that they do that are above and beyond. And we're going to share a little bit of a clip with you about the Orts who have really gone above and beyond. They take a lot of children. They have been probably one of the visionaries, if you will, around developing those relationships with birth parents. They've shared a story with me about inviting a birth family back to their home for Christmas and holidays, and even though that child's not in their care any longer, they're still like surrogate grandparents to that child. So that is a really cool story. They have also developed NOAA, which stands for Neighbors Lending a Helping Hand, offering a helping hand, and is named after their child that they adopted out of the foster care system many years ago. So we're going to share with you a short clip, I think it's about a minute or so, about a new project that NOAA and the Ort family is putting forward in an effort to support all of the children in Marathon County who are in out-of-home care.
And I'm your IT support, it's rough. Let's see.
A nonprofit in Marathon County is hosting a bike and trike drive this month.
That's right. Neighbors Offering a Hand, or NOAA as it's called, is a foster care closet serving foster families here in Marathon County. News Channel 7's Brittany Dobbins is live in Mosinee this morning to tell us all about the bike and trike drive. Good morning, Brittany.
Well, good morning, Holly and Sydney. Now, NOAA is looking for people to donate gently used or new bikes just like these for every single child in foster care in Marathon County. Now, the reason the organization is doing this is because the month of May is Foster Care Awareness Month. It's a time where the community can come together to help enhance the lives of children and youth in foster care. NOAA's goal is to get 180 bikes and trikes at all varying sizes, and the founders say bikes can mean the whole world to a child and believe every child deserves one.
I think a bike is something special to a child. I just remember back to my childhood, and as you look back as an adult, it doesn't seem maybe that special, but as a kid, it's like the whole world, right? I've got my own bike, it's shiny red or whatever color it is, and it gives you a sense of freedom, it gives you a sense of confidence, and it's how a lot of kids spend most of their days.
Now, they are about a quarter of the way to meeting their goal of 180 bikes and trikes, and their plan is to hand them out at a foster care family picnic in partnership with Marathon County Social Services on June 21st. Now, if you would like to donate a bike, you can go onto their Facebook page to see all the lists and sizes that they're looking for, and you can either donate or get it shipped here, or you can schedule an appointment to drop it off. Reporting live in Mosinee, Brittany Dobbins, Sunrise 7.
So you heard at the end, she mentioned the Foster Care Appreciation Picnic. So that's one of the events we do each year to recognize our foster families, where they come with their children. And we have lots of food, fun, all kinds of things that happen. Face painting this year, we're having a bouncy house and hoping for no wind. So yes, that's just one event. We do lots of other things during the year to assist in foster parent appreciation, which helps our retention as well. So at this point, we would see if there's any questions, but then we also have a request for you as a committee, if you're willing to listen to that.
Yeah, why don't you go ahead with your request first, and then we can do questions afterwards.
All right. So our request is because the Orths are such a wonderful foster family, as Krista had given some highlights, and then you can see from the video, they do all of these things on their own to help lots of families in the community. We would just think it would be very special if this committee would in some way show appreciation for that family in particular, perhaps by just writing a letter of acknowledgement and appreciation for all they do.
I think that's something we can do as a committee.
Sure.
Huh? I will connect with you to put something together, and then as a committee, we can send that to them.
Absolutely. We really appreciate that. I think that'll mean a lot to them. Thank you.
Are there any questions?
I just have a comment. Thank you for presenting today. As a former foster parent several years ago, I know the challenges and the appreciation and the rewards that we get as foster parents by having these children in our homes, and through the several children that we've seen in my family. I do stay in touch with one young lady who is getting married, and it's nice to follow up and see how they turned out, if you will. I think every foster child that we've had has been successfully transitioned into adulthood. And it's really rewarding to see that. And I thank you guys so much for what you do. As a foster parent, former foster parent, we know the kind of support that you give us, and it's really appreciated. So thank you for that.
Thank you for those comments, and I'm glad that you had a positive experience. I'm sure you made quite a difference in the lives of those children. Thank you.
Absolutely.
I have a question, since we were talking about childcare earlier. How does access to childcare affect the whole system, people's ability to serve as foster parents? What happens if you get a child that needs to be in childcare and you don't have access to that?
Sure. Yeah, that is something that their foster care coordinator and their social worker will help them to work through and to locate. We have a great relationship, excuse me, with our child care certifiers. And so if they are having a conflict with locating child care, it's certainly something that we assist with. We do cover the child care bills. So that's not something that a foster home is responsible for, as long as it is a certified provider. That's something that we are able to cover. If they're not able to find a child care center, which has definitely been a barrier for some of our foster parents, they can have somebody who has been ran through a background check and all of those good things into their home to provide that care to the children within their home setting. And then that is also something that we are able to reimburse. But it can be a barrier for some foster homes accepting children who are younger, who need foster care. And then another barrier for us in terms of recruitment is definitely for foster homes who are willing to take teenagers and older children with more complex needs. That's an area that we are also in need of recruiting foster parents for.
Thank you.
Thank you.
Are there any other questions? Great, thank you both. Oh, you go ahead, Administrator.
Yeah, before Vicki and Krista leave, I just want to, I think this is a good opportunity to show again your role as a committee. You can pull out your strategic plan again. You know, I like to start with, why do we provide all the services we provide? You know, we talk a lot at the county board and the committees about what services are mandated. We have to do them. The state says we have to. Social services is like the best example of that. If you have nothing better to do, you can peruse Chapter 46 of the Wisconsin statutes. If we don't do it, no one else will. I mean, social services, there's no private provider that will step into. We have a core responsibility. We have to do that. That said, the statutes don't answer every question about what should be the county's priority. So when you look at your objective 3.3 and all the things that Vicki and Krista are talking about, the ways that, and Supervisor Cavelli, about the way that we work with foster parents to create the most sustainable system we can, look at the goals that you set and the strategies that staff worked with the board to develop and the outcome measures that are there to guide us to see if we're moving the needle. And you'll see there's a lot of room for the board, again, to play that visionary role. Develop a plan to reduce childhood trauma. When Krista and Vicki are talking about all the efforts we do before a child gets to foster care to keep children in the home despite the challenges that may exist there, we do that because not only because you put it on the plan, but why you put it on the plan, why it's a strategy is that we know there's a lot of data that suggests and demonstrates, I should say, that removal of a child, even from a home that has a lot of challenges and is unsafe, and moving them into a wonderful foster family is nevertheless traumatic for a child. So we really try to do all the things we can to address the safety issues within a home to allow that child to stay there, or as Krista and Vicki talked about, this idea that we work to create this team mentality between the birth parents or relatives of the child and the foster parent, because we want the foster parents to want the child to return home, because we know that, quite honestly, that is the best thing for those children. Because as Supervisor Cavelli talked about, you know, children that transition to adulthood, everyone becomes, at some point you become 18 and you age out of foster care. The vast majority of those times, even if that child isn't with their birth family on the day they turn 18, they go back and form that relationship or reinstitute that relationship shortly thereafter. So we want to make sure that we strengthen that. So developing that plan to reduce childhood trauma. Strategy D, develop a framework for building resilient children. All those things about, you know, creating when we have a child that maintains a strong relationship with their foster parent after they are returned home, we know that a child having one positive relationship with an adult is a significant resilience factor that mitigates the impact of adverse childhood experiences. You've all probably heard the term ACEs. That's really important. So all these things were, again, when I frequently say, hey, we'll determine the how, you guys figure out the goals and we'll develop the strategies, you pick the ones you like. Your role is very, very, very important. And all those things that Krista and Vicki just talked about are in this document. And when we talk about the outcome measures, how do we know if we're doing a good job? Number 2, we want to reduce the number of days that we have children in foster care, in out-of-home care. That's outcome measure number 2. We want to, if we have to remove a child, we want to do all we can as quickly as we can to get the child back to the home of their birth parents as promptly as possible, provided it's safe and supporting. But all those things come together under that umbrella of, hey, this is a core county service. As we said during orientation and the last several of your meetings, counties are prohibited from doing a lot of things, right? We are creatures of state government. We exist where they tell us to exist. We have some level of flexibility, but this is one of those core areas where we are mandated to provide a service. It can't be somebody else. So we need to do we need to do a great job because it's vitally important work. So that's all. Thank you.
Thank you.
Thank you very much.
I have another question.
Oh, go ahead, Supervisor Krause.
I was wondering, you said that the priority was to keep the child in the home when possible. And I was wondering what kind of team or supports are there that would work with a problematic family, parents? What kind of programs or supports do you help them with to keep the child in the home? And when the child is taken out of the home, what kind of supports do you continue with or promote to have that child come back to the parent's home?
Yeah, that's a great question. There's a variety of supports that are offered to families, whether the children are in home or out of home. For families, whenever we start working with them, the priority is always to maintain their safety in the home. So even if we identify a safety threat within that home, we're working with the family and their natural support system and community providers around what can we put in place to make that child safe in the home today. Right now. So sometimes we might have a child who we're saying is unsafe and needs to be removed unless we can have somebody come in and provide 24/7 supervision. So we might work with their natural support systems to say, hey, grandma, would you be able to come and live with your daughter and your grandchildren for a period of time, provide 24/7 supervision while we provide services to your daughter, which might be a variety of things such as mental health services, AOTA services, parent education services. In-house at Marathon County Social Services, we have 3 parent educators who run an evidence-based parent education curriculum. And so they are working with almost all of the families that we are serving. They can work with families whether their children are in their home or out of their home, as can all of those other services. There's also a grant that has come down from the state called Targeted Safety Support Funds, which we can utilize to sometimes pay providers. So maybe if grandma says, well, I can't do that because I need to maintain, my income to pay my bills, there's times that we're able to provide her some supplement to come into the home to provide care for the children. We might have to remove those children if we don't have a strong natural support system who can do some of those things in partnership with us. And we can do that under what's called a protective plan. So children might enter into a foster home, but not a formal out-of-home placement where I as a parent might agree to say, right now I need some time to work on what I need to work on, and I agree to have my child go to a foster home through a protective plan. They're voluntarily doing it, they're signing a form, and we're doing visitation services all of the time, whether it's a formal plan or an informal plan, to make sure that those connections stay really strong and providing that family all of the support services that I spoke of earlier while we work to get that child back in home.
Thank you.
You're welcome.
Thank you. All right, next we have item 7C, North Central Healthcare Introduction, Mort Mcbain. Thank you.
Thank you very much. Pleasure to be with you today. Get to talk a little bit about North Central Healthcare. My name is Mort Mcbain, and yes, I was called out of retirement to be the interim director at North Central. I was previously the county administrator, as most of you know, for 22 years. And then I was enjoying my retirement for the last 12 years until I got a call from the board at North Central in regards to their upheaval with their executive director leaving and their finance director was leaving. And they said, could you come back to work just for a few months and help us get sorted out here till we get a new director? And I said, okay. So I went back to work, and I'm learning a lot, more than I ever wanted to know about mental health and North Central Healthcare. I want you to turn to page 10 of your strategic plan first. And I'll just read objective 3.7 on page 10. It says, ensure that every person has local access to effective mental health treatment. That's North Central, right there. Every person having access to mental health treatment. No, it doesn't talk anywhere in here about homeless populations or underserved populations or transient populations. It simply talks about the county responsibility to provide these kinds of services to county residents. So now we can turn to that little handbook I gave you. I looked all over for something that was sort of short and effective description of what we do. We do a lot of things out at North Central Healthcare. If you turn to page 6 on your document, just looking at all the facilities we have on the campus and off the campus, that tells you a lot of the story right there. Now you'll notice in there, for example, that we have, primarily we have the campus for mental health treatment. We have Mountain View Care Center. That's a 144-bed skilled nursing facility, a nursing home. We have the Aquatic Therapy Center. We have the Youth Hospital, the Crisis Stabilization Unit, the Community Corner Clubhouse, and then under group homes, we have a whole bunch of residential facilities where people stay, usually people who are recovering from mental illness or some other mental addiction or alcohol or drug addiction. We have group homes in town. We have supported apartments where we provide subsidized apartments to residents who, again, are either in need of the housing or who are needing a place to recover. Or just simply a subsidized rental operation, as Supervisor Krause was talking. There are some people that just don't have any resources, and they are eligible, of course, for subsidized housing. We provide some of that housing, but that's not the primary goal of North Central. The primary goal of North Central Healthcare starts on page 11 of your little booklet. And there are several sections listed there, and we'll get into those in a little more detail. Skilled nursing. We operate 2 nursing homes, one in Wausau, one in Merrill for Lincoln County. And those are highly skilled nursing homes. We offer specialized care for Alzheimer's, for example, for people on a ventilator permanently. In Wausau, we have a specialized ventilator unit, and we also offer convalescence services for drug and alcohol addiction recovery. Then we have the Aquatic Therapy, which is basically a big therapy swimming pool. And people who utilize that are people who suffer from arthritis or certain kinds of diseases that affect their ability to move. And that's a therapeutic pull, very specialized type of pull for certain diseases and disabilities. Then a big one is developmental disabilities. That, to distinguish when we're talking about mental health, when we talk about developmental disabilities, that is the population that you're probably most familiar with who are cognitively disabled, kids from birth who cannot function in a normal setting. These are your special needs kids, and they grow up to be adults. And that is your developmentally disabled population. They cannot function by themselves. They need to be in a residential treatment facility or a residential supportive facility. And then the mental health section, that can be a transitory kind of experience for some people. And we're seeing a lot of that in the aftermath of COVID, you know, with kids and adults being stressed out with all the things that are going on. And when that leads to a mental health disability or when they cannot function, then that's when they can come to North Central and they can get help and treatment and therapy to get back to normal. We have addiction and recovery services, both for drug addiction and for alcohol addiction. And then we have adult protective services, which is where we treat people and help people who are in need of protection. They cannot protect themselves. They're the vulnerable population, and that includes the elderly population who are often in that category. So let's flip the page, turn to skilled nursing on page 12. And I'll just mention one thing that happened recently that shows our pride in the services that we provide for this county. Every year we have a survey team that comes to inspect the nursing home. And this happens every year with every nursing home in the state. These inspectors come in and they're there for several days. They go through every aspect of the nursing home. They check the patient charts, they check the progress reports, they check how people are fed and bathed and tended, and they write up all the deficiencies that they found during their 3 days on site with their team. Last month, for the first time that we can remember, Mount View Care Center, which is the big nursing home on the campus, received 0 deficiencies. They had a perfect score. That is almost unimaginable. The average score in most of these situations is 7, 8, or 9, usually. If you get 6 or 7, you're considered good. We had 0 deficiencies, meaning we were doing everything properly that we should have done. That is the source of pride for what we do. And I just have to mention that. You can see in there that the best nursing homes, we are listed as some of the best nursing homes by U.S. News and World Report. Both our Wausau facility and our Lincoln County facility are both listed as the best nursing homes available. Then we have a little blurb on the Aquatic Therapy, which takes care of a lot of individuals who have musculoskeletal conditions or like fibromyalgia, arthritis, lower back pain, and those kinds of issues. And this is the only place where you can go to get that warm water therapy. Then the big one on page 14, mental health and substance abuse. And I want to just address Supervisor Krause's concerns about the homeless situation. And I understand exactly what you're thinking, because we do have a homeless population in this county. We don't talk about it a lot. Every county has a homeless population. And those that say we don't have any problem, they're just not, either they're unaware or they're not being truthful. Everybody has a homeless population challenge. It may be big, it may be small, but they're always there. But the question becomes, what are the resources for those homeless people? North Central Healthcare is not a homeless shelter, is not a homeless treatment facility. But with most homeless people, many homeless people, there are underlying mental health issues. Sometimes it can be from drug or alcohol addiction. Sometimes it's just mental health. They're not mentally healthy, and they cannot function. But North Central Healthcare cannot and does not provide services just for strictly homeless problems. If a person has an underlying defined problem with mental health, then we can help them. Not because they're homeless, but because they're suffering from mental illness. Same thing with alcohol or drug addiction. If they have that addiction that's prescribed or identified by a doctor or physician, then we can help them under that umbrella of addiction services. But if they're just homeless, we cannot provide residents support to them because we have so many other things that we have to provide. And that's not one of the things that we do. But what we do, if you look down the list on the left of page 14, emergency crisis. If a person is having a nervous breakdown, mental, cognitive crash, then we can treat those people. We accept them into our crisis unit, and they're treated. Suicide prevention falls under that category too. If we know of someone who is threatening suicide, they can be referred to North Central for treatment, and they can take up residence there, and they will be treated by professional counselors and psychiatrists. Then we have the adult and youth behavioral health hospitals. Now, behavioral health is different from developmentally disabled people. Behavioral health is like when people are acting out, they're not in control. They have to be treated for their anger management, and this is seriously violence-prone individuals who cannot control their behavior. That is a mental health problem, and we treat those people, and we treat the youth that come with those kinds of issues too. Both youth, they're separate, of course, but we have a youth hospital, we have an adult hospital for those who are suffering from serious behavioral problems. We have the Adult Crisis Stabilization Unit. That simply is a crisis stabilization process that gets people stabilized, normalized, if you like, and back to their normal life. Substance abuse, we have day treatment for that. We also have residential treatment for substance abuse, but it can also be day treatment where they come in. Sometimes they've been assigned there by the courts, and that is another way that we get patients and clients. They're assigned to our services by the court, by the judge, because they are in need of evaluation or therapy. We have outpatient services where you can come and be treated and seen by psychiatrists on an outpatient basis. Then we have community treatment. We have individual placement for community treatment. You can show up there and just ask for help, and you will be treated. We have the clubhouse, which is for recovering addicts or recovering mental health patients. It's just kind of more of a social setup for them so they can transition back into society without just walking out the hospital and then faced with the same old problems they had before. Then if you turn the page, I want to just close with a little bit of what you have on page 16 and 17. Developmentally disabilities. Again, these are things that we do for children and adults who have ongoing, permanent disabilities with mental health. We have pre-vocational services. That's a subsidized employment service where people who are cognitively disabled can work in a sheltered workshop doing certain kinds of tasks that they're suitable for, and it provides them a subsidized wage, if you like, so they can live somewhat independently. Many of these people live in our residential homes, though. Then we have our community living. That teaches those with a developmental disability how to live on their own. We have residential facilities that teach people how to cook, how to make a bed, how to wash their clothes, how to use the laundromat. Life skills for those who are cognitively unable to do that without help. So we teach them how to be independent, how to live on their own. Adult day services, again, that's for the same clientele who just need to come in and be taken care of during the day. I had a call from the parent of one of these young people just the other day. And she said, we'd heard a rumor that you were going to close the day services, and our son goes there every day and he's worried. And I assured her that we were not closing the day service. She heard some sort of rumor. But that's if you have a developmentally disabled child. We used to call these kids retarded kids. Now we call them special needs kids. Well, these kids grow up, and some of them can't live on their own. And so what do you do? What do you do if both you and your spouse are working, and you've got a 21-year-old cognitively disabled kid at home that can't be trusted to be by himself? He's going to set the house on fire or something. These people can come to our day program. We pick them up with our bus or our van, and we bring them to the center, and they have activities there each day. And then we take them home at night. And that's a real need in this county. And if you've ever had a child like that, you know exactly what the need is. And you'd be surprised how many children and young adults are like that in our county. And we are obligated to take care of them, and we do. Adult Protective Services on page 17. You can see from the picture there, these are the people that we're dealing with. These are people that really are vulnerable in our population and need support, need help, and sometimes need a place to stay, and they need to be structurally organized so that they can have a reasonable chance at living a normal life. We teach them, we educate them how to live by themselves, and then we support them. And these are people that are usually on disability or SSI perhaps, that cannot just function normally. So those are all the people that we treat at North Central. The rest of the booklet is mostly orientation for new employees. But I just want to, well, first of all, I'll stop and ask if there are questions about any of these services that we provide. I know this is kind of a lot to absorb. We have, just to give you an idea of the size of this operation, we operate in 3 counties. We're a tri-county organization, approved and certified by the state. Okay, we operate in Marathon, Lincoln, and Langlade counties. We have almost 1,000 employees that work for North Central. We have a huge campus out on by the airport, and if you have a chance to come out sometime, I would be glad to show you around. We're right in the middle of a huge remodeling and rebuilding project, and you'll be hearing more about that later. Next week I'll be at Finance Committee, and we'll be talking about some assistance we need from ARPA funds. You've probably heard this before, but we have some cost overrun problems with our current remodeling project, primarily due to COVID. You've probably heard of things like supply chain restrictions and materials cost overruns. That really has affected us in the last 2 years. And as a result, our latest phase of the project is somewhere between $2.5 and $3.5 million over budget, that is. When the project was bid out, we expected a certain amount, certain range of the bids. And we asked in advance, are you going to get within our bid estimates? And Marion Construction said, no, we cannot possibly bid it at that level anymore. Prices have gone up so high for building materials in the last 2 years that we're talking about being $2.5 to $3.5 million short of our current phase of the remodeling project. So we'll be back at the end of this month, the county board, to ask for some ARPA help here. to finish our project, that phase of the project anyway. So that's what we have at North Central. It's an amazing resource, I have to tell you. Almost 1,000 employees and a huge campus in 3 different counties, providing services primarily to those who are mentally ill or addicted or developmentally disabled. That's who we serve. So if you have any questions, I know it's a lot to sort of soak in, please just look at this and read this at home, and just I'll give you an idea of some of the things we do. And I'm thinking it might be a good effort sometime for us. I remember years ago, we used to have the county board come out to North Central once a year. And we'd host them, and then we'd take them on for your regular board meeting, and then we'd take them on a tour through the facilities. And it really opens some eyes when you come out there and see what is right there in Marathon County, serving your neighbors, your residents. And so maybe we should talk about doing that sometime. Right now, it's a little difficult with COVID and with remodeling going on. The place is all torn up, but at some point, I think it would be great for you to come out and see what you have for this county, serving this population. It's really something to be proud of. And I know we don't come here very often to talk about it, but it's a huge service to the people that you know in this community. So with that, I'll just ask if there are any questions. Yes, Supervisor Kraus.
Thank you. I receive, as do the other board members, I believe, on their iPad, the newsletter every week, and I am so impressed by it, what a wonderful employee staff you have, the positive attitude, the cooperation, and the awards that you give, and all the different events. It seems like just a wonderful place to work, and it's just exciting to read the newsletter and see so many exciting and happy events occurring. I know in the past, because this is my 3rd term as a board member, that there was a point when there was difficulty getting psychiatrists and psychologists. And I think I have seen where you have hired more and expanded your staff. And I was wondering if you are planning still on doing that, or if everything's okay now, stabilized, or if you are continuing to expand.
Great question. I wish I could say that the problem is solved, but that's not really true. The challenge with what you just talked about is that it's an ongoing problem, continuous problem. Every year we have this problem. We go through a cycle and we'll be fully staffed with psychiatrists, then one of them leaves. And we have to go out and recruit another one. And it's very hard to recruit psychiatrists, I can tell you. Especially, we are not the highest paid organization when it comes to medical professionals. We have a hard time competing with the hospitals. They can pay, because they're private, and some even nonprofits can pay a lot more than we. We're a public employer. Our employees are all in the state retirement system, just like the county employees in this building. And so those are government level wages and salaries that we pay. And so we can't pay, the top level for psychiatrists and psychologists and doctors and professionals, but we do the best we can. And we can mostly keep fully staffed, but sometimes we get in a bind and we'll be short of a psychiatrist or two, and then we just go out and start recruiting again, and the process goes on. It's a continual process. It's not something that you fix and then it's okay. It's a continual challenge, just like it is getting other employees sometimes. Nursing employees are really hard to get right now. And again, we're in a little bit of a disadvantage because we don't quite pay at the same level as you can get for a big hospital like Aspirus. But we still have to have those nurses. So we offer them the best benefits we can, and we do offer them the retirement system, which is great, I can tell you. And so we do what we can to keep fully staffed, but it's a continual problem. That's a great question.
Thank you.
Are there any other questions? I'll put in one plug for your new facility. It's beautiful if you haven't been out there, but they also have a coffee shop on site that is
Yeah.
open to the public, and you can go sit there and do work and read a book and have coffee and food.
Yeah, the bistro. We're very proud of that.
It's a great asset.
Well, thank you very much for your attention, and we'll be talking to you again soon when we get to county board this month, okay? Thank you.
Thank you very much. On to item number 8, next meeting time, location, announcements, and agenda items. 8A, committee members are asked to bring ideas for future discussion. And don't forget, we're going to talk about the updates to the strategic plan next month. And then item 8B, next scheduled meeting Wednesday, July 1st, 2022 at 3 p.m. What was that?
I believe that should be July 6th.
Yeah, it is July 6th? Okay, so our agenda says July 1st. Is it? Okay, okay. Thank you. Wednesday, July 6th, 2022 at 3 p.m. Item number 9, adjournment. Do we have a motion to adjourn? Arstead, second by Covelli. All those in favor say aye.
Aye.
Thank you. We are adjourned.